Now that you've learned what a blood pressure is and you've learned about the equipment that you will use, and you've taken some time to do some of the exercises I had you do in reading a blood pressure, I'm going to demonstrate how you actually take a blood pressure. So first you would get your equipment. Of course you need your blood pressure cuff or sphygmomanometer, and you need your stethoscope, you need some alcohol, and your pen and your paper. Okay? When you're taking a blood pressure, you need to provide privacy. If your patient is at the nursing home in the main area, just watching TV or whatever, you need to take them to their room, close the door and or pull the curtain so that they have privacy. We never do it out in the open. Okay, next you want to make sure your patient's comfortable. If they have a bedside stand or a table, you can put their arm on it with their arm support on the table and their palm up. If you don't have that, I'll show you, you can just kind of hold it next to you like that. So the first thing we're going to do, we're going to make sure we go in and introduce ourselves to the patient if they don't know who we are, and wash our hands and tell them that we're going to take your blood pressure. So Mrs. Rosenglick, I'm going to take your blood pressure. Okay, and I wash my hands. I'm going to clean my stethoscope. And remember to clean the earpieces as well as the diaphragm. Okay. Now make sure you remember that you need the ears to point forward when you put them in your ears so you can hear better. The other thing you might want to do is some of your stethoscopes have those dual heads, so you kind of want to rub and see if you can hear it. If you can't, you just flip it and then feel it. Okay? All right. So I'm going to roll her sleeve up. If they have something that's too tight, you may have to put the cuff over it, but it's better to do it on bare skin. Or you can take it off. That's the best thing to do, so that they have a bare arm. And again, I want her arm about heart level. So that's about heart level. And I'm going to support it. Her palm is up. And there's different kinds of cuffs. I usually put it so that one tube is on one side of the arm, one tube is on the other. And some of them don't have the little metal thing like this one does. This is an older one. You're going to make it nice and tight, about 1.5 inches to 2 inches above the antecubital, the bend in the elbow. Okay. This can be attached sometimes. Let me see. Is there a good place? Well, let's just attach it right up here. That's not going to hurt you or anything?
No.
Okay. So that you can see it. Make sure that you have the bulb in your dominant hand and you've turned the little valve to the right, not overly tight, just tight so that it will pump up. Okay. Then you're going to look for the pulse by feeling. And you're going to use 3 fingers across the antecubital, somewhere between the middle and the inside aspect, and you're going to press. And I feel it right about there, so I'm going to put the stethoscope there. Don't use your thumb. You have a pulse in your thumb. Usually I'll put a finger on either side. I'm going to put the stethoscope in my ear. Take the bulb in my dominant hand so that I can move the valve. And then I'm going to pump it up to 160. If you don't know their blood pressure, you don't want to go higher than 160 because that will really hurt. But if you release it and you hear it right away, you do need to totally release it and let it rest for about 45 seconds to a minute and then pump it up higher. When it gets up to 160, you're just going to slowly release it. When you hear it first, and I heard it at 142, then you're going to just keep listening. You want it to go down, the needle to go down about 1 small line per second. when you don't hear it anymore, that's the bottom number, and I heard it at 84. Stop. I'm going to release all the air. I'm going to take the cup off. There we go. Thank you. And then I'm going to use my pen and my paper to write down, because if you have several to do, it's real easy to forget. Or if you have somebody ask you a question, it's real easy to forget what the blood pressure is. And that's how we take a blood pressure.